The healthcare detective Frank Lalli has written a book for Simon & Schuster about how to get affordable healthcare, called Your Best Healthcare Now. It is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade and the former editor of Money and George magazines. And this is the definitive Medicare for All. Ladies and gentlemen, I present to you the healthcare detective himself, Frank Lalli.
Hey, what an introduction.
I felt like
so
it.
I'm going to start with a public service announcement. Medicare for All, you've heard so much about it. You're going to hear that phrase again and again. Medicare for all intents and purposes right now is dead. It's on a shelf. So a plan for government-financed health coverage for everybody, universal coverage, every soul in this country, is not necessarily a bad idea. But it's going nowhere because the two Democratic presidential candidates pushing the idea can't seem to explain the benefits as clearly as I will in the next couple of minutes. So look, all right, let's start here. We have to face the fact that our healthcare system is broken. We have 40 million Americans have no health insurance. Another 40 million are underinsured. And under President Trump, I'm sad to say, it's getting worse. Now, we're talking just about out-of-pocket health costs for a second here. They're up about 50% in the past 10 years. Wages are up 30%. You got the math? Okay,
I can do that.
Every cent in wage increase and more is being eaten up by health costs. That's not sustainable. And here's the result of it. Half of all the people who get sick in the United States, the richest country in the world, can't afford to pay their medical bills, and that includes people with insurance. 1 out of 2 people who get sick can't pay their medical bills. You know the result of that. More bankruptcies. Medical bills, number one driving force. More than 600,000 people are declaring bankruptcy in the United States because of medical bills that they cannot pay. So, okay, Joe. This has got to change. This has got to change. It's got to stop. This is not sustainable. Here are the options. We could wait for President Trump and the Republican Party to come up with a great health care plan. He's been promising for 3 years. He hasn't done it. He said he was going to do it this summer. He hasn't done it. It's like waiting for Godot. It ain't gonna happen. Forget about it. So we have to turn to the Democrats. But they're split. Most of the Democratic candidates say we should just improve Obamacare, the Affordable Care Act. Yes, we can make it a lot better. But frontrunners Elizabeth Warren and Bernie Sanders say, no. We need to scrap the whole healthcare system. It just doesn't work. It's dysfunctional. We have to get rid of private insurance. We have to get rid of insurance coverage at work. Got to start all over again, create a government-financed system that covers everyone. Universal coverage with no premiums, no copays, or deductibles. Okay. But the let's improve it crowd says, whoa. Hey, you're going too far there. That's radical. What we simply need to do is create a public option. What's a public option? People could keep their insurance. You'd have an option, including the people who, and there's 150 million people in this country who are covered at work, okay? You can keep your coverage. You're in a union, or you're a manager or an executive, or you just got a generous boss. You've got pretty good health insurance at work. Great, keep it. But if you don't, you can choose to buy into a government plan, the public option, which would be something like Medicare, a couple of versions of it. But essentially, you get a chance to buy into a Medicare plan. Some call that Medicare for All who want it. You have freedom of choice. Warren and Bernie say, oh, wait a second. That's really Medicare for All who can afford it, because you still have to buy in, right? And we're telling you that something like 30 million Americans actually don't have the money to do that. So therefore, they're going to go without insurance. That's not universal coverage, and not a hell of a lot better than we're doing already. They swear that their plan, covering everybody, universal coverage, is a better idea, a better path to go down. But they have 3 big problems, Jill. These are big problems. their plans would wipe out coverage at the workplace. Well, guess how that's going over with workers, right? 2/3 of the public oppose that idea. Even if their insurance is not the greatest at work, it's
at
what
least
they
they've
know
got
and
it.
what they have.
Right.
Yeah, exactly. You can't take away my insurance.
I don't understand that, though. Really and truly, I don't understand how you think that you can sell that.
Sell taking away the insurance?
Yeah.
I don't think you can sell it. No, I don't think you can sell it. I really don't. I mean, people don't like it. I mean, it's overwhelmingly they don't like it. Furthermore, so that's problem number one. Problem number two. Universal coverage is going to cost $3 trillion a year. Everybody sort of agrees on that number.
Wait 1 second.
Yeah.
Are they, in fact, taking it away, or is it being transferred?
No, they would take it away. It would be illegal to have private insurance. It would be banned. It's something like a 4-year waiting period or something before it kicks in. But essentially, no, it would be illegal to have health insurance, to have that kind of health insurance, comprehensive health insurance at work. Be illegal.
So therefore, you would be have to transfer it to this other plan.
Yeah, you wouldn't have it any longer, and you would then buy the public option. You'd buy into a Medicare-like plan.
I see. Okay.
Yeah, and people are listening. When people turn 65 and become eligible for Medicare, they get most people are awfully happy to have it. But it's different when you say to somebody, I'm going to take away your insurance, and you have to sign up for Medicare. That's a different proposition. Americans don't like that. Freedom of choice. It's a tough one in this country. So anyway, problem number two. Universal coverage is going to cost $3 trillion a year. And I'm not exaggerating that. That would nearly double the federal budget. And worse, Warren and Sanders actually either won't or can't say where they're going to get the extra $3 trillion a year to pay the nation's medical bills. Where's that money coming from? Warren flat out refuses to admit that she'd raise middle-class taxes on me and you. Nope, she won't talk about it. All she wants to talk about is this. I'm going to reduce overall health costs. So your out-of-pocket is going to be less for health than it is now. You're going to be better off as a result of that. But she refuses to discuss whether taxes would go up in the meantime. She does say, I'm going to slam the corporations. I'm going to slam the wealthy. They're going to bear the burden for this. But presented with the question on a silver platter by Stephen Colbert the other night, she just refused to discuss taxes and just kept saying, yeah, but I want to approach this from a cost basis. Bernie's more straightforward. Bernie says, yeah, look, for some people, a sliver of the middle class, your taxes would rise about something like 4% or so, but it's really only a minority of Americans. And taxes are going to go way up, much, much more on corporations. And the wealthy, they're the ones who are really going to be paying. But his numbers don't add up to anything like $3 trillion. Now, Jill, you know me. I grab an envelope and a pencil. I check this stuff out. The numbers don't add up to $3 trillion. So at this point, I would say Medicare for All, practical purposes, is dead. It's on a shelf someplace. Because Democrats and Republicans are writing it off as a pipe dream. Never going to happen, never going to get passed. And this is the thing here, Jill. It's a shame because Medicare for All could be this country's best option. I mean, it works in Canada, it works all over Europe. There is universal coverage. And here are the facts, and this is so frustrating to say this. Here are the facts that Bernie and Warren can't seem to get across to the American public. I don't know who their speechwriters are, but they just can't seem to make this point. Okay, maybe your taxes will go up. Probably not, but maybe, okay? Your boss's taxes will definitely go up. But guess what? Both you and your bosses are going to come out way, way ahead. The average family now pays more than $5,000 in health insurance premiums alone each year. Under Bernie's plan, if your taxes went up, they'd only go up by $1,000. So you'd save, so the average family is going to be saving something like $4,000 on premiums alone. And remember, you wouldn't have copays, you wouldn't have deductibles. You're going to come out way ahead. And here's the point, Jill. Why can't they explain this? In this country,
beats me.
Under Medicare for All, there would be no such thing as medical debt. Okay? There would be no medical debt because the government would be picking up all the hospital bills. Right now in this country, we've got $81 billion in overdue medical bills. People are going bankrupt. There'd be no medical debt in this country. There's no medical debt in Europe. In Canada, there's no medical debt. Plus, and here's the real bottom line, your boss would do even better. Because the average employer right now is paying $12,000 a year for each worker's family, $1,000 a month. After they pay Bernie's murderous high taxes, your boss would be paying $3,000 for every worker. So your boss, him and her, right, they're going to be saving $9,000 a year on every worker under Medicare for All. So why Bernie and Warren can't make this point forcefully just spins my head. Maybe they're afraid that if they actually say this out loud, the progressives will say, oh, wait a second, Medicare for All is actually a giveaway to corporations. And we progressives don't like that, those greedy corporations. This shouldn't be happening in this country. We've got to refigure the whole thing. Maybe that's the argument. But if they did make the argument that your boss is going to come out way ahead, now do the math. If the employer is saving $9,000 on every worker, you got $150 million with insurance. Do the math. Profits go up, salaries should go up, stock prices go up. It's great for the economy, and somehow this has not been even whispered by either one of those candidates that I've seen. And imagine, Jill, how it changes the conversation. If your boss, instead of saying, oh, I don't want Medicare for All, that sounds too dangerous, a radical socialist plan, what if your boss instead is starting to say, yeah, we're behind an idea like that because it's going to save us a lot of money and people will have adequate health insurance and I'm not going to have to worry about health costs each year that blows a hole in my budget. You could have executives all over the country saying, yeah, we want Medicare for All. That changes the whole conversation and makes this idea viable once again. And at this point, I'm saying it ain't viable until Bernie and Warren get better speechwriters and start to explain to people the real benefits of Medicare for All, even after taxes might go up, okay, for you and certainly for your boss.
Yeah, you would. And they're also, to be fair, or at least equally unfair to everybody, the media coverage of this sort of thing is not terrific.
You're absolutely right, because it's complicated and people don't understand healthcare. Look, when I started doing the reporting on healthcare, and I'm a pretty good reporter, right? Did it all my life. It took me about 2 years to understand our system. It's complicated, it's contradictory, and it keeps changing. There's always an asterisk, and then you've got to look up, oh, there's an exception right. for ingrown toenails. I didn't know that. So it's very tricky. And the average political reporter, they're too busy covering other stuff to really be a healthcare expert. So you're absolutely right. We don't, and the debates are crazy because you got 75 seconds to explain something like Medicare for All. And everybody is, and these guys aren't doing it.
No, but also people are so busy. This is a broad generality. Again, apologies if I'm offending anybody. They're so busy trying to get a headline to capture fleeting attention spans that, in my view, the first person who insists on it's like, okay, sit down. We're gonna spend a few minutes on this because it's important that you understand. Has a better shot of getting through than.
Yeah, but how about this? How about this, Jill? So now we're going to discuss Medicare for All. Okay, let me explain the benefits for you. The average family is going to save, $4,000 a year on premiums alone, and they won't have any medical debt in this country any longer. And your boss is going to save $9,000 on every worker. This is the best thing that could happen to the American economy and your family. Okay, I just did it. I'm within 75 seconds. Why can't these people do that?
I don't know. Let's try that. We're going to run out of time. We're going to try a little test, though. I wonder if someone actually said, you said it. Let's see if anyone picks up on it. Let's keep saying it. Let's see what happens.
Let's keep, yeah, absolutely.
No, 75 seconds. That's pretty clear.
All right, here's one more thing I got to say before we sign off here this week. It's time for you to get your Medicare renewed. Okay, everyone with Medicare, Medicaid, time to get your Medicare renewed. The deadline is December 7th. You and I, Jill, need to talk about this a little bit more as we move forward. But there's your deadline, December 7th. Start thinking about renewing your Medicare, which means you've got to do a little research. If you do, you're going to save money and get a better plan. And in future broadcasts, I'll be helping you with what's new on the plans this year. Bottom line, prices go up a little bit, and Medicare Advantage is going to have a decided advantage in benefits and also cost, but those limited networks always make me nervous. If you need a doctor, you want to go anywhere in the country and get a doctor. You can only do that with original Medicare. Anyway, got till December 7th.
Thank you, Frank, the healthcare detective and the health correspondent for Parade. Send your questions or concerns about finding affordable healthcare to healthcaredetective@robinhoodradio.com. Frank will try to address as many of your questions as he can on future broadcasts. Also, look for his book, Your Best Healthcare Now, available online, in-store, and, as everyone knows, on my desk.